Hello, this is Dr. Brian Thompson. I'm a psychologist at Portland Psychotherapy. This is part one of a two-part presentation. I initially gave that at the research meeting in our clinic. The purpose of it is to demonstrate ways in which a therapist could use an act consistent form of exposure. The title of it is Contextual Behavioral Exposure, to give it it can be used in any sort of contextual behavioral model. The main background is from an acceptance and commitment therapy perspective, and it's just a way to look at how to use exposure in that consistent way. As a way to illustrate various points, I compare it to a traditional CBT approach, and I realize that there's no one specific cognitive behavioral approach to exposure, that there are a number of different models. My main point of comparison is with more of a habituation-based model. I'm not trying to create a straw man argument here, but just to use it to highlight what may be different or unique about using an act-based exposure model. So the first question is, when might one choose to use exposure? And I think it's helpful to consider exposure when there's a particular stimulus or stimuli avoided. These might be thoughts, memories, or images, emotions, or interoceptive experiences, bodily sensations, or particular places, objects, or situations. Through exposure, from an act perspective, one may expand behavior repertoires and develop psychological flexibility. In particular, one may use exposure when avoidance behavior interferes with valued living. And I'll talk a little bit more about that. A component that I often don't see emphasized in the literature enough, although it is there, is that before really considering exposure, it's important that a client be able to engage in the exposure, and it may be useful to do some informal assessment of the client's abilities. For one, can the client discriminate among the private events, the thoughts, emotions, bodily sensations, and are they willing to be with an aversive or uncomfortable stimulus? Some different ways, so in that cartoon there, some different ways of assessing that are just kind of noting a client's ability to notice thoughts or notice interoceptive experiences. In that image there, the client's saying, I don't know what I'm thinking and feeling in my body. I'm not thinking or feeling anything. I just know I'm anxious. And I've had clients that are like this, that they're so fused with their experience that they know that they're uncomfortable and they can put a label to it, anxiety or depression, but they can't really pick that apart. They're unable to identify a single bodily sensation associated with anxiety. And when asked to make the discriminations, they may become frustrated. In this image, the cartoon is saying, no, I'm not willing to experience that, not even for 30 seconds. I need to keep those feelings away or I'll kill myself. And this is just a demonstration of a lack of willingness, that the client here is not able to or not willing to tolerate the aversive stimuli or stimulus. There may be beliefs that if someone is willing to be with something, that they will end up becoming suicidal or becoming angry or doing something destructive. In these cases, there may be some fusion around the difference between experiencing a thought or emotion and acting it out. If a client is unable to make the discriminations or is unwilling to be with something that's uncomfortable, it doesn't mean that one would completely rule out exposure, but there may be other things that may be done to help prepare them for exposure. Ways to strengthen core skills. For example, if someone cannot observe thoughts, one might model it with the ACT exercise, take an inventory. I'm having a thought that, and the therapist can model that. I'm having a thought that I don't understand this exercise, and so on. And if they're unable to discriminate among bodily sensations, you might start with a place of tension, and often people can notice discomfort or tension, and to try to help shape from there. That can be a particularly tricky one for you. And even prior, one might engage in creative hopelessness, kind of helping the client to track that avoidance strategies may not be very helpful, that they may in fact backfire. And this slide here is just a list of ACT exercises and metaphors that may help lay the ground for exposure. It's not an exhaustive list. Some are more creative hopelessness, some are more willingness, some are more diffusion, some are a combination of several different processes. They may be used concurrently to clarify points or strengthen behaviors, and many of them are forms of exposure in themselves. So once you decide that a client may benefit from exposure, it's important to be clear about what the client would be agreeing to if they decide to engage in exposure with a therapist. It's important to have some buy-in, what it will involve. And from an ACT perspective, it's extremely important to tie it into values, that through engaging in these exercises, how might it help them move towards valued living? Again, even using the word exposure is not important. But it is important to discuss the process, offer the rationale, and solicit feedback. To tie it to the cost of avoidance and what values exposure may help them move towards. So here is kind of a caricature of a less satisfactory way of explaining exposure. Here the therapist is saying, exposure is a revolutionary technique that will fix your brain and cure you. I use it with practically everyone. How about it? And the client is saying, well, I don't exactly know what I'm agreeing to, but you're my therapist, so okay. Again, probably no one actually does this, but my main point here is that it's important to describe as well as you can what it will involve, rather than we're going to use this thing called exposure. And here is hopefully a better explanation. Again, it's more of a prototype, not a one-size-fits-all. But in here, the therapist is saying, exposure is a way to learn to be with what you tend to avoid. The goal is to practice being with things that are uncomfortable so that you can live the life you want. Client responds with, sounds scary, but I'm so tired of feeling stuck. So there's a little creative hopelessness here. What I've been doing really isn't working. Now, your actual discussion of exposure with a client will vary depending on what you want to address and what the client's goals are. And this is the end of part 1 of the exposure presentation. And there is a second part that you may click onto.